Good morning, everybody, and welcome to this special healthcare update. I'm Bill Russell, President of Lake Norman Chamber of Commerce, and we're excited to have this update from Atrium Health. I'm going to turn this program over to our Public Policy Chair, Jeff Tarte. Jeff, if you'll introduce our speaker and take it from there.
All right, Bill, I appreciate it. Well, today we have the honor and privilege to have kenhaynes, who's basically the #2 guy. I know he carries an EVP title and president for the Charlotte area, but really functions as the chief operating office for the entire corporation of Atrium Health, which is, the largest healthcare system in the state of North Carolina. And something we'll be talking about later this morning is a pending merger with another health system in the Midwest, which will bump them significantly up the rankings in terms of size, put them over probably 65 to 66 hospitals, will be a $26 billion enterprise and one of the top 7 or 8 health systems in the country. So it's a major responsibility to take care of that many citizens and patients around the country. But Ken's got an impressive background. I mean, he's been 30 years, I believe, Ken, in the healthcare industry. I think you came out of Christus, which is one of the top 10 health systems prior. Tremendous background. You came out of one of the health systems that had a major academic medical center, which is going to be something that we'll be talking about as that gets added to the Atrium portfolio as well. He understands all aspects of running a healthcare enterprise, from day-to-day operations and nursing, pharmacy, urgent care, EDs. He gets the whole package. It's got quite an amazing community involvement. I know you've been involved with several chambers. You're currently on the Charlotte Regional Alliance. I believe, actually, are you on the board for the North Carolina Hospital Association?
I am. Yes, I am. Yeah.
Which represents all the hospital entities across. And then he's got the distinct honor of being, we were just talking about it a minute ago, from his educational background. His school will be the first or next expansion NFL team, having his undergrad, I believe, from the University of Alabama. So roll tide. And then I believe you have an MHA and an MBA, both from UAB. And as we tease, for us that have been here this long, and in full disclosure, my wife's been with Atrium. She's a physician, been here now a little over 30 years. And we used to tease that it's the UAB mafia that came in and helped run and take Atrium, Charlotte Medical Center, when we moved here 30 years ago, was maybe $100 million hospital system, and now 16 billion headed to 26 billion. It's an amazing story and what you've been able to do. And again, it's an honor to have someone of your stature and background and literally recognized as one of the healthcare leaders, literally nationally. So Ken, with that, I'm going to give you the floor, and it is again an honor to have you with us today.
Wonderful. Well, after that introduction, I might need to call it laryngitis and step down. Jeff, you were obviously, Senator, you were very kind with your remarks. We are a blessed organization that's had a wonderful, rich history of success with our community, and we take it very seriously to continue that journey. So we'll talk about elements of that, both from a community perspective specific to your community, but the larger community and the impact we can make across the proverbial industry. I do tell a little war story every once in a while when I get introduced that way, Jeff. 30 some odd years ago, I pedaled in late at night on a taxi and saw CMC, and it looked so big. I was actually an administrative resident. I was in the recruitment process for that with Dr. Harry Nurkin. And so the starter, I guess, of the Memphis, of the UAB mafia. And so anyway, it was just awesome. Harry was awesome. I was probably gonna get the offer. I already had one, didn't want to string them on, so I pulled out of the search. So I've always watched this from afar, both from the standpoint of the beautiful growth of the Charlotte community and the phenomenal success of at that time, Carolina's healthcare system. So it's a blessing to be a part of the team, and you'll hear me say that many times. We have an amazing group of leaders and caregivers, and your wife included. I mean, we've got so many people that are talented. Last night, I had the opportunity to endow a chair in our Levine Cancer Institute. Dr. Amin, who's been with us for many years, had an endowed chair. Levine family was generous with their endowment. And just, you see all of the healthcare heroes in that room. We're just incredibly blessed. I had the opportunity earlier in the day to join with some executives on a panel with the folks at Fort Bragg relative to special ops. And I will come back and say, because I said this last night, it feels good to know we got those folks taking care of us. I mean, they're just amazing men and women in uniform, ready to sacrificing. Gosh, right before we left, a gentleman had been shot 3 times and had worked through healthcare, was looked much more fit than I do, just ready to go back in and make a sacrifice. So it was a beautiful day. And then to come and finish up the day with our special ops peeps, our awesome caregivers, it was just inspiring. So we've got lots of great things going on, and we do have an industry that, having gone through pandemic, that has a lot of things that we're going to have to navigate. So you'll hear that in my remarks, but we're very, very blessed as a system. I'm going to share just a few slides that talk about and kind of frame our system. And then I'll look forward to getting into our questions and navigating what is on the mind of the community, because, at the end of the day, that's what we are. We're a community resource. We're an organization that has a mission statement that you see in front of you about improving health, elevating hope, and advancing healing for all. So for all obviously means our entire community. Not to say anything disparaging against for-profit entities, but as a not-for-profit, we are working at the community's call, and we try to advance that every day and be better at it every day. So we take that very seriously. We work in each of our communities to meet the specific needs of a community. We don't think that we know that going in. We touch base with leaders and we make sure we understand what they need and how we can go about impacting that. So we'll go to the next slide. When you look at us as a total and just the kind of the overall dynamics of our numbers, we do have a large group of teammates serving, upwards of 70,000 in those 40 hospitals that we have going into our merger. We want to make sure, and you'll hear this a lot in our platform, we want to make sure we're providing care closer to home. We want to make it convenient for our patients. We also know there's a scarcity of resources, so there's places where we will put the highest acuity elements and work and complement with those local assets. But our urgent care centers and our EDs are a piece of creating that closer to home care. And then when you think about our cancer care, it's a neat story to say we make that close, but we also have Levine Cancer Institute that, again, Mr. and Ms. Levine last night, I got to thank them for the umpteenth time, because it's amazing what they allow us to do at Levine Cancer Institute by having those centralized resources are second to none in the United States. And so we bring those wonderful caregivers there when we need to do those quaternary elements. And then we can't even start to talk about healthcare without talking about our physicians and what they mean to our delivery system. We've got just absolutely amazing talent. I think great people attract great people, and that flywheel effect has been in play for 20 and 30 years. So we just got awesome physicians. And we've also complemented that with our APP, our advanced practice provider component. So when you put it together, we really, have the best and the brightest. We also don't employ all our physicians. We have a hybrid model. We have some private groups that we're quite proud to be working with. CNSA, our neurosurgery group, OC, the orthopedic group, our ENT, Sienta, many private providers that help complement this as well. And then you'll hear us talk about our nurses today in 2 ways. One, they are the backbone of the delivery. They touch those patients each and every day. But we're also in a situation in our industry where we need to grow that population. So every public official that I get to talk to about the wonderful things we have going on, like we'll talk about today, the Pearl, I remind them that we've got a talent war and we've got to replenish our nursing force. And so we're working diligently to be a big piece of that next generation for nurses. And then, when we talk about our size, as you alluded to, there's the, $13 billion element of who we are. And if and when we go forward with our advocate award, and we're excited about that, that'll kind of double that number. But more important to us is really, you know, what impact we're making in terms of outcomes for quality, but also impact in the community. So you see here our 3.6 billion that we've been able to reinvest in equipment so that we can provide that care. And then next slide, please. You know, we do on a daily basis $6.7 million worth of uncompensated care or community benefit. So, you know, that one is one that we're very, very proud of because it shows that we walk the talk of being a not-for-profit that cares about our community and is impacting it every day. Kind of fun to talk about today. You know, I mean, 43,000 people today will be touched by our team, which is awesome. Our physicians, again, big piece of that, and those physician visits. You know, 3,300 people will come to us scared that they've got an emergency need, and we'll address that in our emergency department. And you see the rest of the numbers. We're excited about, you know, our virtual platform. We've been a leader in that before. You know, it was cool. The pandemic obviously created a lot of opening for virtual care, but we did that well before that was a pandemic phenomenon. And we actually did it again well before it was reimbursed, and it's still not reimbursed well, and we're working diligently to advocate for that. But we do believe that's an important piece because, again, that allows us to take those scarce resources and spread them over a bigger platform, but also makes it easier for our patients to be delivered. And it allows us to get into our rural communities and continue to solve those problems that we know linger in the rural community of healthcare. So we're proud of that. We'll talk about that. And then, you know, 76 either Tar Heels or Blue Devils or maybe a few Gamecocks, Bill, will come to be with us today. And then, you know, surgery obviously is that major point of care. We do over 500 in a day. So next slide. As I alluded to, you know, we not only are proud of the overall impact from an enterprise perspective, but we believe you do that one community at a time. And obviously, speaking with you all from a Lake Norman perspective, I wanted to make sure we let you know we've already been a major community member, and we've already tried to impact the community in a big way. You see here, you know, several specifics listed that we're proud of. You know, food insecurity and the social determinants is loud and clear in our data in terms of how people navigate health in their own self and navigate the healthcare system with us. So we play big in the food insecurity, and we'll continue to address that as much as we can possibly do that in conjunction with the many other not-for-profits and the community assets that they're in place. But you see those here. We're very, very proud of that. And we really, you know that there are many underserved individuals, and there are many people that don't have insurance or provision through Medicaid. And, you know, we're advocating strongly for Medicaid expansion. But until we do get that, and even probably after that, we know these clinics are critically important to embed in the community. And you see where we've invested time, energy, and efforts in each one of those, and have for many years. So we're proud of that. Next slide. You know, you know, as you mentioned, Jeff, I joined the community about 6 years ago. And when I did, it was one of the first things that you learn was that we were one of the largest cities without a formal 4-year school of medicine. We had a 3rd and 4th year, you know, component with UNC and valued that for many years. But we were excited about being able to do that. And as we were looking at partners, Wake Forest School of Medicine was just clearly a great partner for us to have the conversation and ultimately put the piece together. So we're very, very excited about that combination. We're a couple, 3 years into it. Outstanding caregivers, great people, very similar mission and culture in the sense of doing it for all. And so it really was a pretty quick courtship to say this could be a great thing for our community. You know, when we're looking at it from an overall healthcare system, the beauty of it turned out to be that, you know, the School of Medicine was a key component of it. The minute we said or announced it, everybody's like, oh gosh, we finally are going to get our 4-year School of Medicine. And in fact, we will and are doing that. We've already transitioned to those 3rd and 4th years with Wake. And then we're going to build the school out over between now and 25. 24, we'll actually have our first full class here. So it's an incredibly exciting time for us. It's going to be inside the Pearl. We'll talk about that in just a second. We believe it will allow us to grow that next generation of caregiver, hopefully keep many of those in our communities at home here in North Carolina. But we do believe that the piece of having the School of Medicine, along with our incredibly complex and sophisticated operation of care already with CMC and our entire system, we really can drive some amazing economic elements for our community. And we'll talk a little bit about that. We really, have had a research arm. This will allow us to take it to the next level in conjunction with Wake. We do believe that the part of economic development will be that commercialization of many assets and some things we've done, kind of quietly before. We really think there's a flywheel effect to that, putting it together in the Pearl. And then we want to make sure that our School of Medicine isn't just as the mayor has heard us say, and I heard her repeat it on a site visit to Austin, we don't want to be just your mother's school, your grandmother's School of Medicine. We want it to be a unique setting where we're innovative in our approach to teaching, and we really want to talk of having a diverse and student body so that we can continue to have diverse providers that reflect our community and can help us grow that connectivity to our diverse community and take down some of those inequities that we've had historically and that came out loudly in the pandemic. So next slide, please. So real quick, the innovation district that we've named the Pearl, given the connection to that part of the community, we're very excited about it. Kind of probably doesn't do total justice as to where this is, but just north of our CMC quaternary campus, but right off the uptown growth, we were able to take some land that we already had in a data center that was in the process of going to the cloud. And then, as you know, if you're in economic development and real estate, you have to be kind of quiet when you bring these pieces together, because in a growing community, everybody would like for the number to be larger. I was convinced when I was signing those first few acquisitions that there had to be crude oil underneath this dirt because it was really expensive. But when you reflect over a 3-year journey, now our appraisals say, they're worth multiples of what we bought them for. But again, we kept trying to bring it together so that we could have a great nucleus for our School of Medicine, but something even bigger for our community. And because we've been able to put those parcels together, we really are getting a lot of energy and success. Next slide, please. Well, before I jump there, but we can keep it on the slide. What we knew was that because we had the great caregivers and already the nucleus for research, we knew we could go out and talk to the innovative world of biomedical devices and all those pieces. And so we already had Siemens sign on going, when can we come? And so they've been a big player in investing. And we've announced that one. We've got 4 or 5 other major ones that we're going to announce here pretty soon. But ERCAD, our opportunity to have a international simulation lab that'll bring additional physicians in for training, really is another component of this, and a catalyst for this, along with our School of Medicine. So more to come on it, but we're really very excited about it. With that, let me transition real quickly and kind of land the plane more towards Lake Norman. Again, we have been in that community for many, many years and love the fact that we're providing care for lots of community members there. And can't do any HIPAA violations, but I know some important people on this call get their care with us. And we really do take that very seriously. And so I want to make sure before we talk about what we're going to add, we see what we already have. And so you see our tree of life dots here on the various components of our ambulatory platform and our physician platform. We mentioned earlier we have urgent care, and we certainly have freestanding ED components up there, but we have many of our physicians that provide care up and down that corridor. So we're very, very excited about the delivery through our physician assets. Next slide, please. So let's talk about our latest and exciting component that we're designing even as we speak, and we'll be building in short order. But we knew that we had a lot of patients coming to us from that market and making the drive down to CMC. Some of those quaternary components, that'll continue, because that's, again, we definitely don't want to reproduce things that don't need to be reproduced. But we also knew that the primary and secondary elements of care from acute perspective, we're having to make that drive. And it probably been a good thing if we'd done that before the tollway got completed, because when I first got here, it was all pretty ugly travel up through there. But still, that's a long way to go for care. So we knew we needed to have a care site, and we worked diligently to find the right location. And we were so excited about Cornelius and the location that we'll be able to put our asset, because that is a growing community. We felt like that was a centralized location to make sure we're making it convenient for our patients. Very excited about it. The piece of land, y'all know the history better than I do. It's an incredibly important piece. And so we were excited about getting that. And it's certainly large enough to complement that. Right now, we're just worried about our healthcare assets on the end, but we will continue to look for a secondary component to that, because we know that that's important to the growth of that community. It's important for that location, and it'll allow us to get better access off of the interstate. But to begin with, you know, we're coming out of the ground with our 38 beds. 26 will be your medical surgical and LDRP, the OB component where mom delivers. We will have 4 ICUs because we know that some patients will present and need immediate intensive care provision. In healthcare, you have an observation component, because some people come, you don't know if they need acute care. We'll have 8 of those. That'll allow us to flex in when we do have things like a pandemic and have to grow our footprint there. We'll have 2 ORs, and we do expect that to be something we will grow pretty quickly. After that, we'll have a C-section room, procedure room, and all the major imaging and lab components that we would have to have a full service hospital. So very proud of that. We'll also have a 11-room emergency department, so we can provide that emergency care that's needed in our community that will complement our freestanding that's down a few exits. So we're excited about being able to build this and bring it to the community. We've done something sort of similar to this on the southern part of our community in Union West. It won't be identical, because again, we customize what is needed for the community. So we're continuing to make sure we know what you all need, and we'll make sure it's specific to Cornelius and the surrounding area. So next slide. And then, you know, obviously it will be a building that sets up our people up to do great care. So it's about our people, and it's about them providing that care. We're proud to have, you know, upwards of 1,800 of our Atrium Health teammates that live and shop and spend money, time, and energy in that part of the world. We'll be adding 280 to that with this coming out of the ground with our hospital, and that'll continue to grow. And that'll be upwards of 15 million in a payroll perspective. So we are excited about bringing that to the community and being a deeper part of the community. So next slide. I will stop here and say thank you for the opportunity to speak to you all today, and look forward to the questions. But we take it very seriously about being part of a community. So look forward to the community conversation today. So Senator, thank you for having me, and Bill, thank you for letting us tell our story.
Well, it's an amazing story, and if we got a little bit of time, we're going to kind of go through a few questions, and I want to touch in 3 areas that you had mentioned, Ken. Talk a little bit about the new hospital in Cornelius, a little bit about the new medical school, and then touch a little bit, which we didn't talk a whole lot about, is Atrium's, you know, growth pattern, particularly through mergers and acquisitions and that activity. And full disclosure, I do have my Tree of Life tattoo, because as we'd mentioned, I believe Davidson Clinic, where my wife is practicing, was, I think, the very first physician practice acquisition like 36 years ago with
Right.
Dr. Williams and Brown and those guys way preceding. And so it's been quite a change, as you know, from this area where, you know, 30 years ago, the Cornelius, Huntersville, Davidson area had a whopping total of about 8,000 people in the whole area. And now we're closing in on almost 200,000 people. So you see the growth and the dynamic that's up here. But you mentioned a little bit with the new hospital, and obviously there's a lot of services and practice offices, ED, urgent cares, that Atrium has, as you mentioned, a pretty good footprint in the Lake Norman. How do you see, or how do you guys go through a planning and strategy of how an actual hospital on the ground facilitates or coordinates or works with those other entities, or are they totally operationally independent?
No, they're interdependent. Great question. And it's important that we make that happen from a leadership perspective, because sometimes, you get kind of siloed in your approach. So we work diligently to make sure we're integrating our assets and they're complementary to one another. Because I want to be loud and clear, we're excited about building a great physical location to do acute care, but it is about the delivery of care across the continuum with our teammates from all components. So we do integrate that. Our leadership structure is created that way. We have market leaders that lead the collective market. So we'll make sure we're doing things across the continuum. So that's the leadership structure. When from a planning perspective, we go in and we're constantly looking at need analysis relative to where our demand is, and having been incredibly successful as an organization and building on that, we've been up against the capacity issues a lot of times. So we've got several components in that area that's up against capacity, and CMC being where things ultimately flow when it elevates in the care continuum. So, and it's up against capacity. So we are constantly looking at where should we redeploy and do it where, again, it's incredibly convenient to the patient. So constantly look at those analyses. As an industry, we have a certificate of need process, and it's a process that certainly isn't perfect, and not to get too far off into it in terms of you can make pros and cons for it. The pros are it is a planning process, so where you have needs. So the planning department comes out and gives those. So there were needs in our community, in our market. But one of the limiting factors, and it's just the nature of it, is county based. So obviously you all are up against two counties right there as a crossing point. That was the same thing with Union West. We actually did the analysis that we need to take care of these people within a certain number of miles, but that represented two different counties. So we had to decide which side of the county made the most sense for locating, and then which side of the county would allow us from a certificate of need process. So it blends into it, but basically it's community-based need. And so we have been on the drawing board, and you can only do so many things. So we've been trying to process it in order, but we really have been diligent and are eager to get to Lake Norman and provide that acute care asset. And once we had hit that tipping point of knowing we had the need, and then went to the certificate of need process, we're able to rearrange some of our bed assets in the county and allow us to get the certificate of need and be able to go forward with our hospital.
Talking about CON then a little bit, how early do you have to engage in that process from a growth perspective? Because I assume, as you said, you're doing that analysis on a constant basis. So for the Lake Norman area, could this, with the growth that we've seen and still the demand, could we become the next Atrium Northeast? I mean, I vision with the amount of land that you have, one is just the ability and the demand for capacity, whether it be MRI services, cancer, satellite from Levine, what have you. Do you guys get into that kind of analysis?
We do. We will not let certificate of need or a current state impact the future. I mean, we will follow it or stay ahead of it. So what I mean by that is we do believe this is just a start there. We do believe that this is what we come out the ground with and immediately provide the care for, but we're building the building ready to build on. And I'll be honest with you, these two assets that we put in, we do believe we probably should have left the crane up, because we're going to grow that fast. But we want to make sure we're not getting ahead of ourselves. We don't ever want to add cost to the infrastructure or the system flippantly. So we don't want to build buildings to be building buildings. But we do believe we will be able to grow rapidly there. Initially, it will be what we talked about, in terms of beds. But more importantly, we'll continue to add more of those service lines that you saw us listed with dots. We'll have more and more of those individuals relocated there because of the growth. So again, it's about where patient population and need is, and we do our best as a system to respond to that proactively. We certainly, but sometimes we have to react. But the growth, because this is an incredibly growing community, all across the greater Charlotte region. So we love Lake Norman and the growth to the Cabarrus side, amazing growth. To the south side, amazing growth. Even the western portion and the river district. I mean, that's got substantial growth. So we're trying to make sure we're setting up assets. One of the assets that's a little bit hidden to the market is we put a freestanding ED in the Mountain Island corridor. But again, that's complementary to the lake as well. The lake does create just a slight barrier because most people don't want to drive their pontoon across the lake for care, right? So we do take that into consideration when we look at demand, because some of that demand is to the west of the lake and some of it's to the east of the lake. But it's clear that that's going to continue to grow, and we're going to grow our platform.
Well, and one of the things I think some people do know, but hospitals, so healthcare entities and educational schools tend to be the two largest employers in an area, and they have a tremendous ripple effect. So curious what you see, or what's the anticipation or discussion about the tangential assets that will develop around here and how it impacts particularly the Lake Norman business community, from medical offices, people who service it, food service, other things. What would we anticipate coming in conjunction with the hospital?
Yeah, absolutely. It's an economic engine. We know that. We also, I mean, I'm talking to business leaders here too, so I always want to make sure we also know that ultimately, providing these benefits to your employees is a cost of doing business as well. So we take it very seriously to try to be prudent and efficient, but we also know it does have purely economic development aspects to it. So that particular, because it's such a large, nice piece of land, and probably the last of the large, nice pieces of land up through there, we want to be good stewards of that from an economic engine perspective. So we are looking, and we'll be selective on the assets we want to add further on there. They'll be complementary, both from like a medical perspective, like you said, medical office buildings. We're already going to have that on ours and adding others. Our One Health merger, where we brought in those sets of physicians into our family, they're going to have locations there and around the Davison area. So we take, those are secondary effects on economics. But there'll be non-healthcare secondary effects because this is a really nice parcel of land that can have some really neat tenants on it, and we want to take that very seriously. So there'll be the healthcare effect as well as non-healthcare effect.
Well, I just want to give you one idea for a hospital location. Based on my past little part of my career, I spent as the chief information officer at New England Medical Center in Boston, which is part of Tufts, tied to Tufts University. But originally, a lot of people don't know, it was the Boston Floating Hospital. It started on a boat, and then they filled in the back bay and then built on land. So I'm thinking a floating hospital on Lake Norman is a real asset.
Never say never. We're in an innovation, so let's look at it. Absolutely.
The kind of one last question kind of around this as we shift into the medical school, we shift into mergers, and mainly for people listening in and having someone at your level, both, you're obviously one of the probably dozen most important business leaders in the entire metro region. I mean, I say that it's a fact. And you have a national following in terms of when you speak, people listen. So can you speak to, because one of the things I think just the average citizen that's not in healthcare and they watch is where does the collaboration with competitors and other health systems versus when it becomes competition, how does that get balanced, or where's that discussed within the C-suite?
Absolutely. Well, when you were saying all those extra nice things about me, I turned my volume up just in case my 4 kids could hear that, and I don't have to take out the trash later in the day. It is, especially when you do it from a not-for-profit perspective, because, we want to run a strong business, but, we have such a mission-based orientation. We look at it from a perspective of how do we do this for the community? We want Atrium to be the one doing that. We're competitive, but we want to make sure, all the assets are ultimately driving a better community and doing great things by the health of our community. So we work with lots and lots of other not-for-profit elements that complement our work. We're large and our sign is a lot of places, but there are a lot of hidden connections and work that we do in the community that we couldn't do it without them. And collectively we do this work. We also have, other competitors, like Novant, et cetera, But we find places that we can collaborate. You know, this pandemic has been a huge piece of that. You know, we are an incredibly sophisticated operation ourselves. So like monkeypox, we're delivering that care right now. You know, because it's such a high-end, you know, unique set of circumstances, and our infectious disease doctors are so out on the cutting edge that we're doing that for the community and helping Novant, you know, so they'll ship their patients over, but ultimately they'll have, they'll learn in that area and they'll provide that care as well. So we do that complementary. You know, I just got back from our NCHA summer day together. You know, with pandemic, we hadn't hardly been in a room together. We've been on a lot of virtual calls together. So it was just good to see my colleagues across the industry, and spent some time with the CMO from Novant talking through where are places where we can, you know, do better care on this pandemic front. You know, we are a growing community. The healthcare sector is upside down on talent nationally. So we're looking at ways we can work together to grow that. Because again, if we create another nurse, it's good for everybody. So we look at things like that. So there are ways that we collaborate and work well together. But we do compete, and competition is a good thing, and we make sure everybody knows that that's an important iron sharpening an iron element of what we do. Novant's a great competitor, and there are other competitors. It makes us better. So we compete and collaborate.
Well, you mentioned, since you dropped his name indirectly, something I don't think a lot of the region recognizes, that, you know, each year in different categories, but let's talk, I'm just going to mention it and then we'll, because it takes us into the medical school area a little more, is the chief medical officers. I mean, such a critical talent. And you mentioned Dr. Eric Escalou at Novant was named one of those top 50, but equally impressive in Charlotte, having 2 of the top 50 is Dr. Scott Rismiller, who's on your staff, who runs the 6,000 physician practices and nurses across your system. And Scott is an amazing man. I've had the fortune to spend some time with him, and obviously my wife does as well. But there's tremendous medical talent in this community, and therefore the question leads me, as you talk, you know, you guys entered into the new medical school, and it's been a topic for 20 years among business leaders. You know, Charlotte, as you mentioned in your opening comments, is one of the largest metro areas without a medical school. Why does that matter? And if so, why? And why the need for a medical school here?
Well, you know, first of all, let me double down on your nice comment of our talent, and specifically Dr. Scott Rismiller. In spite of being a Georgia Bulldog and a right tackle for them, and I realized that when I first moved here, that's what he was. I was like, I'm gonna run every play behind him. I know how this works now. So no, he's been a great partner, great asset, and he brings together those, you know, thousands of physicians to make sure we're doing right by our patients. And it really, you start going down and I mean, Dr. Derek Ragavan, you know, last night we were in chair investiture, and the talent he's brought in Levine Cancer Institute, you know, Stacy Nicholson, our president of the Levine Children's Hospital, pediatrician in chief, brought incredible talent on our Levine Children's Hospital. And it's because of this great community that we can do these things. But that children's hospital, when I got here 6 years ago, it was 10 years old, and I've been around enough freestanding children's hospitals that were, you know, top in class. And you get here and you see in 10 years we were in the top in class mode. And I told him, I said, this reminds me of a 10-year-old running Olympic numbers. Are we going to send them off and go to the next level, or are we just going to kind of, you know, make sure they're good at their high school sport? And we've just, last 6 years, doubled down, bringing in talent, and it's just amazing. So I can't say enough about that piece of what we do, because this is a people business. It's people taking care of people. I mean, certainly our physical assets are important for that work, but it is absolutely the brain trust and the sacrifice and the hard work and smarts of our clinical staff. So that gets into the question you talked about. It's like, so what does that look like 30 years from now? And there's been a shortage nationally on the physician front. So being able to add to the capacity of delivering the next generation of medical student is incredibly forward-thinking and important. A community as large as this typically does have one. You don't have to, obviously, but it does. So it'll afford us the opportunity to bring in even more talent and grow even more talent for our collective region. Why Wake Forest? I mean, they have a great reputation, and really it's doubling down on that reputation. They'll still be, and always will be, and will continue to grow our platform in Winston-Salem. But we have the ability to have a secondary platform in another location here in Charlotte proper. So those will be absolutely complementary and will allow them to play off each other and grow. So the innovation quarter that they already have up there, along with our innovation district here, will be complementary to each other. And it really, it's caused an incredible amount of excitement at the local level, but nationally, we've got folks that are going, count me in, I want to come. We're doing a dean search, I'm about to wrap it up, and had national candidates on that. We've got, all of our quaternary searches, people wanting to come here because we have a medical school and we already have the chassis of this incredible quaternary center. And then, oh my gosh, what's not to love about our community, right? I mean, you look out the door and 13 cranes have landed, right? At any given day, right? It's just amazing, the growth and the excitement and the energy of the community. So those three pieces will allow us to bring incredible talent and grow the next generation of caregiver.
You'd mentioned earlier that the first medical school class you're looking at probably 2024. Can you give us an idea of the scope as far as how many students you would anticipate in the first class? Will it grow? And then kind of a secondary question, does that present opportunities for you guys? And because there's such a shortage for residencies and fellowships, do you envision adding residency slots and different programs and fellowships or not?
We already educate 3,200 total
Right.
students across, right? 100, different programs, and we already have a pretty sizable platform on, the residency and fellowship. We will grow that, not to wear the viewers out on inside baseball, but, a lot of that's, reimbursed federally and it's been cut over the last 30, 40 years.
Talking about GME?
GME, right. So we'll continue to lobby for that, and we'll continue to invest our own assets in that, because we do. But this is really the medical school itself that we want to make sure we're growing. So we'll come out of the gate with, and I have the numbers, I'm trying to get my head around it, in the 40s, but we're going to have about 100 new students every class when this thing completely matures.
Wow.
So that's a huge add to the larger medical school platform that hits to the shortage of physicians. So, that's the original, goal, is to
Sure.
double what we do. Long-term goal is to double. We'll come out with 46 in that first class. That's really exciting for us, because that in itself, if we recruit the right folks that want to be in our communities and go back and work in some of these rural communities and diverse populations, we can instantly make a difference for North Carolina.
Now you mentioned, I'm going to shift a little bit and take a couple minutes because I'm interested in the Pearl. And I think a lot of people are that are close to this and watching. And we talk about innovation districts and innovation centers, and we've got now digital innovation officers throughout health systems. When we talk innovation, are we talking things like when Da Vinci came along, computer surgery, and does artificial intelligence start playing into this? And are we going to have robots taking care of surgery? Does telehealth fit more into this as well? Can you give us kind of what your vision is for the Pearl and what type of things will be in it?
Well, that might take the last 13 minutes, because the future,
okay.
The future is amazing. We don't want to restrict it. So yes, this will almost be my answer. In fact, yesterday when I was talking to some of those brilliant special ops folks, they asked me a similar question about AI and how it's performing in our sector and organization. This will be a catalyst for elements like that. We do believe that the simulation lab and the ERCAD will allow us to look at some of those be early adopters of some of the technologies you're describing and continue to make sure that grows within the larger sector. But it will be, an opportunity to really not limit the scope of what that innovation district can do and impact on the larger larger platform. We do think it'll create, biomedical breakthroughs. We believe that loudly. What we try to do with our research is try to get bench to bedside quicker. So we want this thing to expedite what we historically have taken 8 and 10 years in the industry to get from an idea to the patient. We want to speed that up. We do believe putting all these components together in one location will afford that, because sometimes it's just sort of proverbial handoffs in the industry that have slowed these things down. If all those individuals together, we can cut those times bench to bedside down. So we believe that innovation element will be at play in the quarter. And really, we don't want to limit it. We want to make sure it has the ability to take those brilliant next generation minds that'll come in from a medical school perspective, all of these industries that want to grow that space. Our clinical platform, because we touch so many patients, we have such a large clinical platform, and really, our DNA at Atrium Health has been able to work with industry. I mean, to get those things to patients. So it's really a blending of all those historical cultures that will allow us to have amazing impact to the community.
Our time's kind of winding down a little bit here, or otherwise I'd keep you till lunch hour if I could. It's just fascinating the stuff you guys are doing. But I just wanted to bounce over a little bit and talk about your growth, and particularly the mergers that you do, because that's been one of the vehicles, both organically you've grown internally, but also by outside acquisition. The big one that's announced, and it is a big one. I mean, it impacts, because the state treasurer looks at it, Congress will look at it from a antitrust competition type perspective. But tell us, if you can, the audience a little bit, what makes the relationship with Advocate Aurora out of Milwaukee, the Wisconsin, Northern Illinois environment attractive for Atrium?
Sure. Well, it is under review right now. So, and we, will certainly continue that process and feel good about that element of the process, but it is under review. So I can't speak to that piece yet. But, when we looked at it from a vision perspective, you look at our organizations and we have, a lot in common in terms of culture of doing for all. So we believe it'll allow us to really impact our communities in a powerful way. We believe that, together we can do more. And we think that this adoption of new technologies that we talked about from the innovation quarter, doing it better, faster, to benefit our patients, our communities, and our teammates. We do believe together we can do that. We've got a DNA that says that together. We think we could do that even better. Healthcare continues to change at a rapid pace, and the pandemic clearly showed us that we've got opportunities inside the care delivery component. Several of the factors that are shaping us going forward. The evolving digital world that you mentioned, the workforce pressures that are absolutely real across all industries, but specifically healthcare in a big way. We can do that together better. Our cost challenges, we've got to continue to be able to afford it within the means we're given, but even want to be able to be more effective for our patients. Health inequities that we've already talked about. The industry is going to have to continue to transform. We think the vehicle will allow us to do that, building on the complementary elements and our unique strengths. And really, we have some diverse experiences across both organizations. We believe combined, we can create a health system of the future and lead across the industry in that regard. It's all about improving the lives of the people we serve and, helping to eradicate inequities in the care system. And we really believe we can do that. Some key areas, Jeff, that I think are important. We do have clinical preeminence. It's all about giving that great care. We both have that, and we think that will be complementary and allow us to do more for those communities and drive patient safety. We both have track records in that. We think that'll allow us to do that even better. I mentioned health equity, and that's so real and so pronounced with, as I mentioned, the pandemic. We just believe that we can be more affordable. We really, that next generation workforce, doing that together, we can do it. So we just really think, and one other, element that we both have DNA in, and the industry, longs for this. The White House just had us up to complement us, but in the environmental sustainability elements of learnings that we both have gotten as systems, we think we can, more rapidly invest in that. for our community. So we really are excited about it.
Just a couple last questions for you. One is, and this is not sharing, competitive secrets internally, but when you go to, because you've acquired a number of systems like Navicent and, Floyd and some of the others, now the discussions with Aurora, what are the criteria that Atrium, the executive team, the board are looking for to be a complementary fit?
Well, your viewers and your team would understand the business aspects. You're looking for things where you can add value to one another. The first thing we start with is culture, to see if the core values match up. When we talk about our mission statement, health, hope, and healing for all, that really is who we are. And so if we're going to join with someone that isn't quite that might be a rate limiting factor. So we always start with that and double check on it. And then, really, again, we're looking for places where we can be complementary and support one another and add value to the collective. When I think about Navicent and down in Macon, Georgia, they've got a children's hospital that, really serves a very unmet need in the southern part of Georgia. And Levine Children's Hospital, when we looked, we said, wow, we can actually take some of our super subspecialists and use virtual, telemedicine and provide elements of care that part of the community would never have. And we've actually saw that and already done that in the first year or two. It's things like that you look for to make sure that, we are, when we reflect on together, will the community be better off? And we go into it with the belief that they will be under these, different pieces, and check ourselves at the door. And we've actually seen that in Navicent. We've done things together, with our weight, piece together. We just joined with the folks in Rome, Georgia with Floyd. Right. And we see places where we can do that. They had a helicopter service that was strong. We've added to that because obviously we have an amazing mobile medicine history. There's just pieces like that we make sure we can add complementary to. The business aspects will always follow, and we can add pieces there, but it really is about helping the community.
Second to last question.
Sure.
You were looking in your crystal ball. You've been in the industry 30 years. The changes in that 30 years is astronomical, especially with the technical innovation, both medical device as well as just delivery. What do you think the next 30 years are going to look like?
Well, it will have lots and lots more change. I think the beauty of some of the technical aspects, the digital platform that you mentioned earlier, is going to allow us to be able to really have more and more technology at the hands of the doctors to be able to do things more efficiently for the patient. And quite honestly, many things, outside our four walls. And we're a big player of the four walls, so we're proud of our environments, the physical environments. We do believe that virtual piece will be really a big part of it. I mentioned earlier our platform on telehealth. I think that's going to continue to go and be a bigger piece of it. Hospital at home, we didn't mention earlier, but during the pandemic, we rolled that out fairly quickly. One of the first in the nation. People have followed that. It's allowing us to, again, get care. It can't hardly get care closer to home than being at home, right? So it's pushing that care into the home. So again, convenient for the patient, less costly, and can deliver it quicker. That's what the future, I think, does hold. We have got to continue to find ways to make it more efficient, effective, and affordable for the patient and drive better and better outcomes as an industry. We're poised to do that. Next 30 years will have lots of that in it. So
it's an interesting perspective because you look, the life cycle and the circle. We started out 100 years ago, the doctors always made house calls. Sounds like we're coming back. It just won't be in a physical, it'll be virtual. So it's fascinating to hear you talk about this. So the last is a combo question. So if you weren't in healthcare and leading one of the most preeminent hospital systems in the country, what would be your dream job? And corollary to that is, what do you do for fun?
Well, I'm blessed with a beautiful family, so I love spending time with my family and doing the fun things of life there. And you know, I'm a competitor at heart, so I might would be a football coach, but that sounds even more stressful than my job now. You know, I love seeing people work together as a team and improve on whatever their craft is. So I think my other job would be something like that. You know, just again, bringing together great people and watching, you know, remove barriers and watching the success is what gets me up every morning. I've got a beautiful team. We have great people at Atrium Health. And just getting to do that is certainly a blessing for me. So it would be something in that vein, Jeff. But I don't want to call out anything because my people might get nervous that I'm about to go, you know, try to take over Saban's job or something.
There you go. Well, Nick would be the one that should get nervous then. But Ken, we appreciate you taking this much time with us on a Friday morning. Obviously, and I mean this sincerely, that you are truly one of the most distinguished alums that has come out of Tuscaloosa, Alabama. I mean, what your career has been and the impact on thousands of people. We are truly blessed to have you as part of our community, and we're glad you're part in leading Atrium. So with that, I'm going to throw it back to Bill. And again, thank you so much.
Thank you. Very kind with your remarks. Thank you.
And Ken, I have one concern that I wanted to raise more so than a question. Other chambers of commerce across the country can offer small business healthcare plans. We're prohibited from that in North Carolina. The one thing that I hear from entrepreneurs and small businesses that is a challenge is the cost of healthcare insurance. And many of our small businesses are rolling the dice. They just don't get the insurance. They're investing it back in their business. Were they to have a catastrophic challenge healthcare wise, it would really be bad for their particular business. It would be really beneficial if the North Carolina Chamber of Commerce, or more on a micro level, the Charlotte Regional Business Alliance, were able to be the umbrella for which we could offer association healthcare plans to the businesses, particularly small businesses that are right now challenged. And again, that's an insurance issue, not necessarily a provider issue. But if you're able to weigh in on it, again, North Carolina Chamber of Commerce, Charlotte Regional Business Alliance, being the umbrella for our chambers of commerce to be able to offer that to small businesses would really be beneficial for business.
Absolutely. I mean, it's the heart of our community, small business. So absolutely, anything we can do to support that work, count us in.
Well, thank you for joining us today. Jeff, thank you again for emceeing, and I appreciate everybody for joining our discussion today on Atrium, talking about what's going on in our market.
Wonderful. Thanks for having me, and thanks for letting us serve your community.
Have a great weekend, everyone.
Yeah, take care.
Take care.